Hello, everybody. Good afternoon, and welcome to one of our penultimate day of Breastival. This session is on when breastfeeding looks different, and we have two fabulous speakers joining us this afternoon who are going to share their own experiences of when breastfeeding worked out in a different way than what they might have imagined when they were expecting their babies. And we have Ruth Young, who is an entrepreneur, momtrepreneur, mom of two, who has been working with low supply with her first baby and now her youngest, who's just come along recently, and she'll be talking a little bit about her journey and the different ways that she has worked to continue to give as much of her own milk to her babies as she can. And we also are joined by the wonderful Gillian Weir. Gillian is a mum, a midwife, and an neonatal infant feeding lead in the Belfast Trust. Gillian's going to talk a little bit about her own experience, but she's also on hand to answer any specific support questions that anyone has. Anyone who's joining us through Facebook Live, we encourage you to ask any questions throughout the session, and we'll try to address those after our speakers have shared their stories. And then anyone who is joining us in the Zoom group, encourage you to use the chat, use your reactions, let us know what you think of the session. We'd love to hear from you, but I'm going to pass you over first to Ruth, who's going to share her story. Ruth, welcome.
Thank you. Good to be back again this year, and I was thinking back to last year and Gillian's story. It's going to be a wee bit back to front because I'm going to reveal a little bit of your story, where you'd said you had low supply issues, and this time last year I just discovered I was pregnant with baby number 2, and I was like, gosh, I'm kind of keen to hear how it went for her second. So it got me all excited, thinking, oh, this could really work for me then. Fantastic. I'll rewind back to when my very first was born. That was back in 2018. Yeah, I got the year right there. And I remember going to antenatal classes, and I was a little bit concerned because I didn't have the kind of, and now my baby's crying here, hold on just a second.
This is absolutely as we expect.
I know, typical. She was fine up until now. Yeah, so I didn't have that kind of that tingle or that pain that you would have got in your breasts in the early stages of pregnancy. And I kind of thought, well, maybe it's just because I've got small boobs or something, you know. And I remember going to antenatal classes, and I asked one of the midwives during the session about breastfeeding, you know, is it possible that, you know, some people can't breastfeed or that they don't have enough milk? I'm kind of worried that I won't be able to exclusively breastfeed. And the midwife at that time says, oh, don't be worrying, it'll all be fine, it'll all work out. You just, you know, keep focusing on putting baby to the breast and skin to skin and drinking lots of water and staying hydrated and all of that. And I was like, okay, well, fine, that's fair enough. And I was very determined that I was going to exclusively breastfeed, and my baby would never touch a drop of formula in their life. And then fast forward to my baby being born, we had a few complications, but it wasn't like huge complications. I just lost a bit of blood, had a bad tear. We got golden hour and all the rest of it, but I was really dehydrated after various laxatives and stuff that I was given after my tear and the repair of all of that. And so all of those sort of things we had thought had lend themselves to me having low supply, just not being hydrated, not having a good blood supply in my body as well. Maybe with my son, because he had lost weight quite quickly in the first few days and went to the neonatal unit, we didn't have enough contact or skin to skin during that time because he was in the incubator. We'd only see him every 3 hours. It maybe wasn't regular enough for establishing breast milk supply. So it was all those factors, and I struggled for months and months, and was beating myself up over it, thinking, why is this so hard? Why can I not do this? I'm just going to show a wee photo actually of him in sort of the first few weeks. And as a first-time mum, I suppose I was still learning an awful lot, but I didn't really realize that, you know, babies were going to look as skinny as that. You know, I didn't really think that was going to be an issue. I thought, you know, some babies are skinny, some babies are chubby, maybe mine's just a skinny baby. And looking at his wee legs, not a pick of fat on him because he wasn't gaining enough weight. He wasn't growing well enough, and I couldn't see that. Now, fast forward a little bit further in our story. because of all of that, we were in and out of the hospital, reviewing his weight, reviewing the feeding patterns, and trying to get all of that established. And we were keen to try and avoid the bottle for a little while to try and avoid nipple confusion. So I have a few more photos just to share, where we were in the neonatal ward and beyond using a little cup. So this was him drinking from a cup, a wee bit like what I've got in my hand here. And you can get these in the maternity wards and on pediatric wards as well. So we wanted to feed him from the cup, and he was drinking well from it, but quite often he was pushing it away as well, and he was coughing up an awful lot. He wasn't looking anymore, so it was quite confusing for us, thinking, why is he losing weight, and why is he not taking more of this milk if he needs more of it? And, it was all these mixed messages. It was all very confusing, emotional. You're tired enough as a new mum with a new baby and trying to work out all of this. So we were trying to top him up with all of that. And then we moved on to the supplemental nursing system as well, which I also have here. You see it in the photo. It's just a little bottle that you fill with your either express breast milk or your donor milk or formula. And you basically just use the little straws, one to go into the baby's mouth for them to drink at the breast while they're feeding from you. But they also get what's in the bottle at the same time, and the other one brings in the air from the other end to make sure it's flowing and there's a suction going. It's a very simple way to keep breastfeeding your baby while also feeding them the supplement that they need, and making sure they're getting all the calories and the goodness that they need to grow as well. So yeah, I said earlier I wasn't keen to be one of those parents that use formula at all, but it had to be a part of our journey. We couldn't have made it at all. Otherwise, this was a necessity for us. It's one of those things that we just couldn't avoid. And I remember when the doctor first had said about his weight wasn't going the right direction, when he was taken to the neonatal unit and so on. They just announced they were putting him onto formula, and that was it. I had no say in that. Although I argued and I said, look, can I get some donor milk? Can I ask friends to donate milk? Or we were coming into day 3 at this stage. The supply just hadn't been established yet, and I was desperate to try and keep him on breast milk, but it just wasn't to be. Because we were in and out of hospital with his low weight gain, we had a doctor listen to his chest quite intently one day, and he said at the end of it that they had sensed a small murmur. It sounded fairly innocent, nothing to worry about, but he wanted to get it checked out, so referred us on to the cardiology team. So at 3 months, we went to that appointment to get him seen to, and I thought nothing of it, because at this stage we had worked out how much formula he needed and how much breast milk he was getting, and we were just maintaining that, and he was growing well, he was following a line. That was it seemed like nothing to me. But we went to that appointment and we were admitted to hospital that night because it turns out he had a cardiac issue. So in some ways, I'm really thankful that my low milk supply discovered this, because we wouldn't have found it otherwise. It was quite a rare thing that he had, and our specialists, our consultants and doctors and so on reckoned, he could be one of these children that you sometimes hear about on like a football pitch or playing rugby or something, or hockey or whatever, and that's it. They just go in an instant. But that could have been him, that he wouldn't have made it to his 20s. We've been very lucky to make it to that age. But it was detected because of my low milk supply, and he wasn't thriving in the way that he should initially. But the extra formula was masking that as we were going further as well. So not to trigger anybody either by mentioning amounts or whatever, if low supply is an issue for you, but during that journey, I was probably expressing about 15 to 20 mils every 3 hours. If I was skipping breastfeeding and just expressing, that was about all that I could get. I was delighted to be able to express a bit and save it for when my son went for his heart surgery in Dublin. So he was able to be exclusively breastfed through his feeding tube during that time, through his time in intensive care and on the ward and back home again, which really helped him to recover from all that he went through. He's fine now, by the way, just to give that little caveat, and being well reviewed and looked after. So through all of that journey, I did speak to lactation consultants and had lots of advice from friends and women on breastfeeding forums and family and anybody who was just giving advice, whether it was asked for or not, about how to boost supply, be that drinking more water, you know, have a reflexology, eat well, make sure you're pumping regularly, do lots of skin to skin, eat lots of oats, fenugreek, what else? Avoid peppermint, eat lots of almonds, all these different things. And I was trying it all, doing it all, taking tablets for brewer's yeast and all sorts of things. And I must have been on, I think, about 16 tablets a day of different things that are supposed to help boost your supply, but none of it was working. And looking back now that I'm on my second journey with this baby, I should have maybe seen that it was indicative of something else. So now we're on to second baby, number 2. Whenever she was on the way, I wanted to speak to a lactation consultant because I was very hopeful after hearing Gillian's story that I could exclusively feed. And I was really excited about this, wanted to be able to put in preparation to make sure that I did everything that I could to make it happen. So I was able to express colostrum before she arrived, and I had a pack of about 80 mils of colostrum, which was quite an amount. I was getting lots every day, and I thought, wow, this is amazing. This is going to work out. I'm so excited. I can't wait just to get on with, you know, exclusive breastfeeding. And as soon as she was born, she latched really easily. She fed for about half an hour, and it was fantastic. It worked out really well. And I thought, oh, relief. You know, this time is going to be easier in that respect. I'm not going to have to do the whole feeding at the breast, feeding with a bottle, or feeding with an SNS, and sterilizing everything and pumping. And in the UK we call it combi-feeding. Around the world sometimes they call it triple feeding because you're doing 3 things at once, you know. But I was just delighted to think about I wouldn't have to do any of that. It was just going to be feeding at the breast. However, within the first week, her weight gain wasn't great, and we ended up in the hospital with her as well. She had dropped 13% from her birth weight. And to look at her, she was doing everything that she should have been doing. She looked healthy. She was responsive in lots of ways and very healthy in lots of ways. And the doctors were a bit baffled. But I knew in my heart of hearts that was the issue with me, that it was a low milk supply thing. Again, so we started topping her up with formula, and did her with the cup and with the SNS, and eventually moved on to bottles as well. So we mix it up with bottles and the SNS now. I have another wee photo just to show you of her with the SNS instead. Tell that we just enjoy being on beaches too, and yeah, just enjoy being out, being able to feed baby as best we can, and wherever we are as well, and not being ashamed about the fact that I have to use formula, as if babies just need fed, really, in the same way that we shouldn't be ashamed to be breastfeeding either. So she, in the back of my head, I was thinking, she got a heart issue as well then? Can we just check that out too? And we got her checked. She's okay. But in speaking with lactation consultants after all of this, these 2 journeys, these 2 low supply journeys, thinking, right, what is it that's wrong with me? Because during my first breastfeeding journey, I did have blood tests done and everything looked normal in terms of the hormones. Had it checked again this time, and again, everything looks normal. So it's very indicative that I have what's called IGT, which is insufficient glandular tissue. And as much as I would try and boost my supply, it's just never going to happen. And I think once I knew that and I realized that, I could make my peace with it and say, do you know what? My body's kicking ass right now. It's doing the best that it can. And I'm happy to be able to keep feeding my baby as best I can, because I know breast milk is best for her. But she also needs the calories. So the formula helps with that and making sure that she's fed and she's thriving. So formula, while it has lots of negatives and so on, definitely has a time and place for people who need it to support the growth of their baby. And I definitely see it as a great tool for supporting breastfeeding. So that's kind of the overview of my journey. There's lots of different things within that, but I'm trying to just keep it quite short and sweet. And if there are questions, we can talk about them at the end as well. But thank you for listening.
That's great. Thank you so much, Ruth. And I think that you're right. The talking about formula use. Formula is a tool, and it's a tool that is absolutely necessary for some people, and it's something that families should absolutely use it if they choose to, or if they need to use it. I think during this week at Breastival, we've had a lot of conversations about the marketing of commercial milk formula, as Nigel Rollins put it. The marketing is the thing that is an issue, but for individual families who choose to or need to use formula, that there is nothing to be ashamed of there. Just the same as Ruth, as you said, there's nothing to be ashamed of about breastfeeding. There's nothing to be ashamed of about formula feeding. But the negative thing that we want to talk about is the aggressive and inappropriate marketing. But formula in and of itself as a tool is something that should be used, and we should be thankful that we have that for situations for when it's needed. Thank you so much, Ruth. Gillian, over to you.
Hello everyone, so I'm Gillian Weir, as Jen introduced me. So I'm actually not a midwife, Jen. I am a neonatal nurse. I'm not a midwife. I feel like an honorary one sometimes when I go up to the wards because the girls forget that. And I'm also a lactation consultant, and I'm the neonatal feeding lead for the regional unit. But what I want to chat to you about today is my own personal journey, which happened long before I was an infant feeding lead or a lactation consultant, and probably really inspired me to become those things and to take this journey. So my story is kind of, I always think, similar to Ruth's. Difficult start. So I had my first baby. She was what we would call IUGR, which means she's intrauterine growth restricted. So at 35 weeks, when I came for a routine scan, I was told that she wasn't growing efficiently in the womb, and that the best option would be to induce me for her to be born, to just see if things were going well, and to ensure that pretty much her placenta had probably stopped working and wasn't supplying her. So I probably was really naive. I was a neonatal nurse at the time, and I thought, I know breastfeeding. I like breastfeeding. I'm supportive of it. I help mums on the ward. Like, I'll be fine. But actually, that didn't happen at all. So she was born, had a natural labour. Everything went okay. Although was small, was very well. And I had been encouraged by the midwives antenatally to express. So I only really had a week to do that, between being told at 35 weeks she was going to deliver and then delivering her at 36. And I had, I think, 15 mils, which I was super proud of. As Ruth said about her 80 mils, I thought I was just it. So when she was born, I took really unwell. She was fine, but I was really unwell. And again, like Ruth, lost an awful lot of blood and ended up in theatre for removal of placenta. And then my blood pressure went through the roof, and I had something I'd never heard of before, which is atypical pre-eclampsia, which actually occurs after the baby is born. So I was, as I was being wheeled out, missed all of the skin to skin, but did encourage my husband to do that with her. So at least the first sort of contact that my baby had was with family. And I was asked, did I want them to cup feed her or syringe feed her the colostrum, but that meant one of the nurses or midwives were going to have to do it. So I did opt out and say, no, please let my husband give it with a bottle. At least he will get to experience her first feed. Went to see her thinking, that's great, they'll give her 5 mils and I'll come back and she'll get the rest. But actually they gave her 15 mils in one go. So that was my stash gone. So I was devastated when I come back from theatre. I was, to say out of it is probably an understatement when I come back. And in all truth, when I look back on it, at the time I was asked, did I want to hold her? Did I want skin to skin? And I kept saying, no, I'm afraid I'll drop her. In all truth, as horrible as it sounds, I had no interest in her. I just felt so unwell and just so past it. So it probably was late that evening. She was born in the morning. It was probably a good 12 hours before I actually got hold of her and felt well enough to hold her and tried her at the breast, and she just could not latch. And the more we tried, the more frustrated she got, the more frustrated and upset I got, and it just wasn't working. And we tried then to express, and I was getting nothing. Anyway, days went on. Barbara Spratty, I'm sure a lot of you might have already heard of, who is the maternity feeding lead in the Royal with me now, was on leave, as typical. How dare she pick her leave when I needed her, but she did. So I did get support from the midwives, but I think they were at a bit of a loss too, because I just wasn't getting milk, and the more I stressed about it, the less I got, which I now know happens. It's a vicious cycle, and it's something that we really need to break. And did try for a long time, for the 3 days that I was in hospital, to try and get her breastfeeding established. I had friends come in that had successfully breastfed their babies. Was a bit naive about it at the time and wasn't really aware of lactation consultants and things like that. Didn't really know that was an option. And to cut a long story short, she never really latched. And when we were going home, we had to introduce formula. She had been very lucky to have been granted donor milk when she was in the postnatal ward because of her weight, because she was so small and because she was a preterm baby. But she couldn't go home on that. So we then very quickly had to make the decision on formula, which broke my heart. And I had absolutely no idea what I was doing with it and how to decide between the formulas out there. Got home anyway and continued to express, probably rather unsuccessfully, and then did eventually get speaking to Barbara Spratt, who advised that I try domperidone, which I don't know if any of you've heard of, but it is actually a gut motility drug, which has a side effect of increasing your prolactin levels. It is a licensed drug, but it is off-license use for lactation, so it can be very difficult to get from GPs for them to prescribe, which is something that I face professionally as a challenge quite often now in the unit. However, my GP was really, really approachable and really helpful and very supportive, and she did prescribe me the domperidone, and it did increase my supply, and I did almost exclusively breastfeed her for several months. She maybe got 1 bottle of formula a day, but it was exhausting, to say the least, trying to express, as we said, I think we should call it triple feeding, maybe quadruple feeding, because you feel like you need about 8 arms to do it. And getting into that cycle of feeding, expressing, trying her at the breast, trying her with the bottle, it was hateful. I really wasn't enjoying my time with her, but I did it for 8 months. And then my supply started to dwindle, and I decided then to come off the domperidone and just to move pretty much exclusively to formula, because my supply did dip. And like Ruth, came to terms with it, and just sort of put it down to bad luck that it just didn't happen, and we'll try again in the future. I was very determined that I wasn't going to let it sway me, because I'm a neonatal nurse and I did not want to be that person that became bitter about it, and then when I came into the unit and seen either other mums feeding, to be resentful, or on the other hand to be discouraged from supporting them to meet their goals. And then 2 years later, I had my second baby, and it was a completely different ball game. So I, this time, like Ruth, was very proactive, and I decided to harvest antenatally. I harvested from 34 weeks, which is not what we would advise, but at the time, again, my baby was, I was being told she was IUGR, and they actually thought they were going to have to deliver at that stage. So because I had started, I continued, and she didn't actually deliver to 37 weeks. So I had 600 mils of colostrum in the freezer. And I thought I was amazing, like Ruth. And I knew the supply was there at this time. I was pretty confident I could see it building every day. And that probably for me was reassuring. And I know it didn't guarantee it when you hear Ruth's story, but it did make me feel a lot more confident. When she was born, she had a really bad tongue tie. So she did latch and she did feed very well, fed well, I say, but I was in agony. So I don't know how well she actually was feeding. And I was advised by the midwives to top her up with syringes of colostrum because their tongue tie was so significant. So I did that. At day 5, she had been referred by Barbara to, at the time it was Martin Curran who would have done our tongue ties, but we now have an in-house service in the Belfast Trust. She had an anterior tongue tie snipped, and I thought, happy days, this is it. I ended up contracting mastitis on the same day and was very ill, but persevered and fed her, and we got through that week, and it was hellish, but we got through it and we made it through, and my supply maintained, and her weight gain was good. And I did still offer her the odd either top up by bottle or by syringe or cup feeding at home, just whenever I was feeling so unwell. I just felt I couldn't lift my head to do it. But after that week, I was still very sore, and I don't know, for mums that have had nipple damage, I think it personally becomes the stage where you think, is this new pain or is this just pain because the damage was already done? So I was hoping that this would start healing, and it did not. And I'll be honest, I was for kind of giving up and thought this isn't going to work again. And had kind of decided that I was going to try and express again. I didn't think my journey would last as long, as I knew it was going to be really difficult trying to fit that in around a toddler. And 2 years ago, you think it was years ago, there wasn't the hands-free pumps in the same way that we now have access to, although I can't rate them because I haven't had that much experience with them, but they are an option. But out of the blue, my little angel, guardian angel, Barbara Spratt, text and said, how are things going? And I had said to her, supply's great this time, everything's brilliant that way, but I am in agony. And she said, come up. So I come up, and she diagnosed a posterior tongue tie, which had been missed with the anterior, and actually gave me nipple sheaths to try and alleviate the pain. So I started feeding with the nipple sheaths, and then we got a referral to have the tongue tie revised again, which did make a difference, but there was a bit of a delay in getting it done, but 2 to 3 weeks. And in that time, I became quite dependent on the nipple sheaths. I don't know if I would say Meredith did, but I was really quite afraid of not using them. And whenever then we got it snipped and I did try to not use them with her, I just felt the latch wasn't as good. I didn't feel she fed as effectively, and I could feel myself getting pain again. So in looking back, probably my latch was not perfect, and I could have done with more support in perfecting that. To cut a very long story short, I ended up feeding her with nipple sheaths exclusively for 2.5 years. So I know whenever we give nipple sheaths out as professionals, we do encourage them to be temporary. And that's still something I advocate because they are just a faff and they can have implications on supply and things as well. But I just want to say that if you find you become dependent on it, you can use them, and don't ever feel like you're not feeding because of it. I don't know if any Breastival probably do know of Jack Newman. I've read a couple of his books and he's quite negative towards nipple sheaths, which really frustrates me because he'll talk about, oh, the baby's not really latched. And maybe he's right, but I always think if it's the difference in a baby latching out a breast and getting that comfort, that closest with mum and having breast milk, or that mum feeling horrible and ending up either bottle feeding her own milk or bottle feeding formula milk, that is the better option. And that's pretty much my journey. I suppose I didn't mention whenever with same as Ruth, I did end up using formula with Harriet. I didn't have to use it at all with Meredith, and I was able to donate some milk with her. I did have a much better supply with her. But definitely formula is not evil. I know it does get bad press. It is a life-saving drug, and we should be grateful that we have it and we have access to clean water. But as Jen said, definitely we need to work with or work against, I suppose, the companies and how they advertise it and how they market it to people, and they kind of make mums feel that they need it. Some mums will, but the majority won't, and that's what we need to try and get across, that the support should be better breastfeeding wise, but also that the formula should not be as aggressively marketed. And that is my roundabout story. It's probably what inspired me to become the infant feeding lead. I managed to get this job when I was on maternity leave with Meredith, so came straight back from it. And I remember having a conversation with Barbara when I was struggling, saying, how could I ever do this job when I didn't think I was going to be able to breastfeed? And being resentful of people who did it and found it easy. And now looking back, to me, I think it was a blessing. The same way Ruth found that it had a benefit to her because she found her baby was unwell. I have been that mum. So when I have mums in the unit that are struggling and that are tearful and are really wanting to give up, I can say, I have been you, and there is a way out. And if we can't get the full supply, we can maximize what we have, and we can still help you meet as much of your goal as possible. So thank you for listening.
That's amazing, Gillian. Yeah, and Gillian, both yourself and Ruth, I think it's so heartening that you have taken a situation where you had to struggle and things did not work out as you had expected them to, and that you're absolutely making the best of it and taking that and turning it around into something that's going to help other people. And Gillian, I think you're absolutely right that you haven't been there, you can really empathize and support women so much better because you have been through that and you really understand what those women are going through when they're struggling themselves. So thank you both. So